Have you ever asked yourself, how does a cough occur? A cough is the response of the body when something irritates throat or airways. An irritant stimulates cough receptors that send a message to the brain in the cough center, which leads to the chest muscles and abdomen muscles to push air-containing irritants like bacteria and debris out of the lungs. Humans have cough receptors in the respiratory tract, pericardium, diaphragm, pleura, esophagus, and stomach. Based on the duration, cough is classified into 3 classes. The first one is acute cough with a duration of less than 3 weeks. Second is subacute cough with a duration of 3 weeks up to 8 weeks, and the last one, which is the third one, is chronic cough. The duration of chronic cough is more than 8 weeks. Acute cough is most commonly caused by viral infections, followed by exacerbations of asthma or chronic obstructive pulmonary disease, or pneumonia. Other conditions to consider, depending on symptomatology, include pulmonary embolism and heart failure. Similarly, subacute cough is commonly post-infectious or secondary to asthma or chronic obstructive pulmonary disease exacerbations. Upper airway cough syndrome is another common cause of subacute cough, while chronic cough is most commonly caused by asthma and gastroesophageal reflux disease. Based on etiologies, the main etiologies of cough can be grouped into the following categories: infectious cough, disease-related cough, and medication-related cough. Infectious cough, these are cough which are most commonly caused by pathogens. This include upper respiratory tract infections, which are most commonly caused by viral pathogens such as coronavirus that affects the upper part of your respiratory system, including your sinuses and throat. Symptoms include a runny nose, sore throat, and cough. Pneumonia, it's also an infectious cough that is a common cause of acute cough. It is an infection of the pulmonary parenchyma. Pulmonary parenchyma refers to that portion of the lungs involved in gas exchange, has the potential to cause severe illness and death. It is caused by a number of infectious agents, including viruses, bacteria, and fungi. The most common ones are respiratory syncytial virus. It's the most common viral cause of pneumonia. Haemophilus influenza type B, the second most common cause of bacterial pneumonia. And Streptococcus pneumoniae, the most common cause of bacterial pneumonia in children. Influenza. Influenza is an important viral pathogen that causes outbreaks in a seasonal pattern, usually peaking in winter months. It is commonly spread through droplet transmission. Tuberculosis. Tuberculosis is caused by Mycoplasma tuberculosis bacteria. It is a bacterial infection that spread through inhaling tiny droplets from the coughs or sneezes of an infected person. It mainly affects the lungs. Disease-related cough. These are diseases that are responsible for the majority of cases of cough. Diseases like asthma. Asthma exacerbation can present with acute cough, as well as wheezing, breathlessness, and chest tightness. Cough and other symptoms are often worse at night and early morning. Chronic obstructive pulmonary disease refers to a group of diseases that cause airflow blockage and breathing-related problems. Heart failure is another cause of acute cough. Cough can be a chronic symptom of heart failure and is often worse at night, as it is due to fluid overload. Pulmonary embolism. Patients with pulmonary embolism often present with cough. Any patients with acute cough who may be at risk for pulmonary embolism should be referred for prompt assessment. Gastroesophageal reflux disease is a common condition, where acid from the stomach leaks up into the esophagus. One of the most common symptoms of gastroesophageal reflux disease is chronic cough. Medication-related cough. Cough is listed as a possible adverse effect for countless medications. Some of the medications that are associated with cough are angiotensin-converting enzyme inhibitors, antifungals, beta blockers, chemotherapy agents, inhaled medications, and immunosuppressants. For treatments of cough, it is important to distinguish a productive cough from a non-productive cough. For patients with a productive cough, antitussive medications should be avoided, as they can prolong and worsen their illness. For these patients, an expectorant such as guaifenesin can be tried, which has a mechanism of action of loosening phlegm and helping to expel it. For patients with a non-productive cough, an antitussive such as dextromethorphan can help lessen their coughing. For bacterial infections, such as community-acquired pneumonia, antibiotics will likely be required. choice of antibiotics depends on severity of illness, previous antibiotic exposure. For patients with influenza, oseltamivir should be considered.